Skin and hair concerns don't actually come with an age limit. Scalp issues, hair fall, acne, pigmentation, we have all dealt with it at some point in life. So, to help us understand what's right, what's not, and what actually works, we are happy to welcome dermatologist Dr. Aiswarya to nellikka.life. Welcome, doctor. So, in your 5-year dermatology journey, you might have treated like most of the patients with the concern of acne. So, basically, we have heard people saying that the acne concern is mostly seen in teenagers, but I have heard from people in their 30s and 40s, mentioning concerns about acne and pimples. So, like, is it common for the people in the age of 30s and 40s to have acne, or how is it?
So actually in adults, acne is a combination of various factors, including lifestyle choices and our skin biology, our hormones. So everything depends on how you manifest your acne.
Okay.
So in people with hormonal imbalances, especially those who are pregnant or maybe who are in their perimenopausal stage, sometimes even associated with your menstrual cycles, or in people who are suffering from PCOD, or even when you're being initiated on or suddenly stopping your oral contraceptive pills. So all these things can contribute to adult acne. Also, it can be a result of the kind of hair and skincare products that you're using. In some people, acne has a genetic basis. So in them, acne manifests during adulthood. Chronic stress is also a major risk factor for adult acne. Sometimes acne can also occur as a part of another disease, another systemic illness that you might have, especially inflammatory kind of disorders. So all these factors have a role to play in adult acne.
So we have seen people, using home remedies or other like anything that is available at home to treat acne and pimples. So the scenario is like whether it worsens the acne or does it actually help in healing the acne?
So it is not recommended to use home remedies for your acne because it's easier to treat acne than the acne scar. So some of these home remedies can be quite harsh on the skin. So basically you should just go for expert advice. So some of the main mistakes that people make concerning acne is pimple popping or picking your acne. So this can lead to acne scars and then it's more difficult to treat than just common acne. Another thing is constantly touching your face or washing your face too frequently. So that can also contribute to worsening of your acne. It is also a mistake to use harsh scrubs and face washes on your face, and you shouldn't be layering on cosmetics, especially when you have an acne aggravation, one on top of the other on your skin. And it's always recommended to wash your face before you go to bed to remove all the makeup and grease from your skin. Another common mistake is to change your skincare routine or your skincare products really frequently. And it is also important to stick onto your anti-acne treatment. Like if you're already on an anti-acne treatment, you have to give it time to act. There are no quick fixes for acne. So before you move on to the next level of treatment, you have to always follow compliantly the therapy that you're given.
Currently what we are doing. Also, doctor, it's a very common term now, the tech acne. So like using of mobile phones can actually aggravate acne is what we have heard. So like, is it true?
Although your phone doesn't directly contribute to the acne form eruptions on your skin, it can definitely add on to many factors that can bring on acne. So for example, your phone screens. If you're sharing your phone with others, then the debris, dirt, sweat, oil, sebum, bacteria, they can all transfer onto your skin from the screen. And this can in turn contribute to acne aggravation. Another thing is some people have a preferred site for using their phones. So in that case, if you're constantly using your phone on that side, then you'll find that the acne is a little bit aggravated on that side. This is because the heat from the phone combining with your sweat, it's an excellent environment for the bacteria to thrive. That will in turn aggravate the acne.
Also, doctor, like acne, it's a similar concern that most of the people raise is hair fall or hair loss. So what are the major reasons that cause like this hair fall? And it's now common in even youngsters. So what is the reason for that?
So age is not the only factor that can contribute towards hair loss. Just like in acne, there are many factors that can actually lead to hair loss in youngsters and old people. So mainly hormonal imbalances, like in the case of thyroid diseases, PCOD, can all contribute to hair loss. In addition, the kind of hair care products that you're using and your hair styling and practices like smoothing and straightening can all contribute to it. Another thing is the medications that you're on. Some medications tend to produce hair fall, and stress again is a main factor.
Major reason.
And also, hair fall can be a manifestation of an underlying systemic disease. So, especially when it is associated with weight loss, fever, and other systemic symptoms, you should go for an expert evaluation.
So, people usually get confused between hair fall and hair loss. So, what is the actual difference? Like, both are same, or does it actually have a difference between? Is there an actual difference between hair fall and hair loss?
So, losing around 50 to 100 hairs per day is considered quite normal, especially when you're combing your hair or washing your hair. And if it grows back, and usually it does, so then it's not a problem, provided your scalp hair density remains the same. But it becomes a problem when your hair is not growing back to fill in all these gaps, and most of the time you can pick it up also. It usually manifests as a thinning of the scalp hair, so you can see the scalp skin through your hair, and then there will be a thinning of the ponytails or your braids. So in some people, it can also present as patchy hair loss or patterned hair loss. Pattern in the sense for men, it can present with frontotemporal recession of the hairline. You can see the hairline going back. And for women, vertex thinning can be seen. So if you have any of these symptoms, then again you should go for expert advice.
So in like all these social media platforms or online platforms, we are seeing several hair serums, masks, that help in hair growth. That's what they demand. So are these serums and hair masks actually helpful? And also we have those hair gummies that tend to increase the hair growth, or the tend to more hair to grow. It helps more hair to grow. So is it actually helpful?
So all these hair care products, they have a different function towards our hair, and they help our hair in different ways. So for example, the oiling of the hair, we are only referring to light oiling with coconut oil, etc. And in that case, to a certain extent, it helps the microcirculation of the scalp, and in that way helps the hair. And also for very dry hair, it can help to moisturize the hair and thereby protects it to a certain extent. Shampoos, on the other hand, in contrast, shampoos help to cleanse the hair and the scalp. So it helps us to keep it free of all the oil, sebum, debris, and any other residues that might occur as a result of our hair care products. So, and serums, on the other hand, they offer a more targeted kind of approach, especially towards hair growth. So, and you mentioned gummies also. So, gummies, what they do, gummies and any other kind of hair supplement, we have to be quite cautious about what the contents are. Most of the time, they are hair supplements, including vitamins and certain minerals. But when you take them over the counter, it is best to be cautious about their contents. So anyway, all these hair care products are like how you should use them is mainly dependent upon what kind of hair you have, and also the kind of problems that you're facing with your hair. So in that way, you can modify the approach to these.
Also, doctor, dandruff is also a very common concern we have heard across many people. Like we have heard people saying that even after a repetitive usage of these anti-dandruff shampoos, they are not seeing any evident decrease in the amount of dandruff. So is it actually dandruff, or is it any underlying scalp condition that they are facing?
So sometimes what you think is dandruff may not be exactly dandruff. It can be a sign of an underlying disorder of the scalp. For example, it can be scalp psoriasis, or sometimes it can be a fungal infection of the scalp and the hair. It can even be a reaction to some of the hair care products or hair dyes that you're using, and sometimes it can manifest as this slight scaling of the scalp. In some individuals with immunological or connective tissue disorders, they can present with scaly lesions on the scalp. So whenever you have thick scaly dandruff like scales, associated with pain and burning sensation, or bleeding from the scalp, or even if the patient is experiencing some kind of patchy hair fall, then it is always best to go for expert advice.
Also, doctor, a similar concern is like tanning or pigmentation seen basically in the elbow areas or the underarms or the necks. So we have many treatments, ongoing treatments happening around us, like the glutathione, carbon peeling, and XYZ treatments. So do these treatments have any internal risks or any external risks? Is there any external risk for these treatments?
So before we go on to the answer proper, I would like to clarify that by skin lightening, we are going to refer to management of pigmentation issues, and through that we are hoping to achieve an even skin tone.
Yes.
Because in dermatology, basically dermatology focuses on achieving and maintaining a healthy, even toned skin. It is not recommended to try and change your genetically acquired natural skin color. And that being said, it is only ever really advisable to go for skin lightening treatments under the guidance of a dermatologist, and that too with procedures or medicines for a limited period of time, combined with strict sunscreen use.
Okay. Thank you, doctor. As we end, let's take back 3 things. Don't ignore the early signs, don't believe in every myth, and don't hesitate to consult an expert. So thank you all for being part of this session.